we report on a successful double lung transplantation from a donor who previously had COVID-19. Late 2019, the COVID-19 pandemic emerged, with nowadays more than 50 million documented infections. Since the virus primarily resides in the respiratory tract, lung transplantation raises the highest concerns regarding donor-derived viral transmission and lung graft quality. We present the case of a 62-year-old woman suffering from end-stage COPD, who received a double lung offer from a 72-year-old female with no medical history, apart from a mild but symptomatic COVID-19 episode. 3 months after the infection, this patient was admitted to the hospital with an intracranial bleeding and became an organ donor. SARS-CoV-2 PCR screening on the nasopharyngeal swab at that time was negative. However, serology revealed positive antibodies. Eligibility for lung donation was based on a repeatedly negative SARS-CoV-2 PCR analysis, excellent oxygenation, and a chest CT which revealed no signs of COVID-19 induced lung injury. The decision to accept these organs for transplantation was taken multidisciplinarily and according to the ISHLT guidelines. The sequential single lung transplantation was performed successfully without the need for extracorporeal life support. A biopsy of the right lung revealed low levels of PCR-amplified SARS-CoV-2 with a delta CT of 35. However, viral cultures of the same biopsy remained negative. Histological analysis showed no signs of lung fibrosis. The outcome was uneventful, and the patient could be discharged at 35 days post-transplant. SARS-CoV-2 PCR analysis on nasopharyngeal swab and bronchoalveolar lavage was repeatedly negative in the recipient, and the chest CT and lung function at 3 months post-transplant were both excellent. COVID-19 will have a long-term impact on general lung health, and it is inevitable that a growing number of potential lung donors will have been infected with the coronavirus. We report, to our knowledge, the first intended successful double lung transplant from a donor who previously had COVID-19. No viral transmission occurred, and we would like to underline the importance of performing routinely a chest CT in all potential lung donors to exclude any COVID-19 related lung damage. In the future, the long-term outcome is awaited, and we encourage in the meantime our colleagues to share their experience. The low levels of the PCR-amplified SARS-CoV-2 in the lung biopsy will be analyzed further with complementary methods.